Welcome to OhioHealth's lung cancer screening program. I'm Dr. Dale Levy. You may have noticed that I referred to this as a lung cancer screening program. As world leaders in cancer care, we at OhioHealth believe that lung cancer screening is more than just a CT scan. Lung cancer screening is a comprehensive approach to fighting lung cancer. In our lung cancer screening program, we will help you develop an effective strategy to quit smoking. We will help you understand the difference between screening for cancer and diagnosing cancer. You will not only learn what to expect from your CT scan, we will help you to understand the results and what you will need to do next. We know that this process can be very intimidating, and we will be there with you. You may have already met one of our OhioHealth nurse navigators. Nurse navigators are an integral part of our patient care at OhioHealth. In our lung cancer screening program, they will help you navigate through the pathways of lung cancer screening. Lung cancer is a major health problem today. Not many are aware it is by far the leading cause of cancer deaths in both men and women. Each year, more people die from lung cancer than from colon, breast, and prostate cancers combined. In other words, lung cancer may not be the most common cancer, but if you have it, odds are you'll die from it. The best chance for a cure for lung cancer is through early diagnosis. And the best chance for early diagnosis is through a lung cancer CT screening.
Hello, I'm Matt Monroe, and I'm here to talk to you about cigarette smoking. Cigarette smoking is the number one risk for developing lung cancer. The longer you've smoked, the more packs of cigarettes you smoke a day, the greater your risk for developing lung cancer. The American Cancer Society states that 80% of lung cancer deaths are thought to be related to smoking. Smoking is a lifestyle decision, and you have control over that decision. If you've already quit smoking, congratulations. That means you're experiencing the benefits of quitting. If you have not quit smoking, then now is the best time to quit. It's hard to quit smoking. It may even be the most difficult thing you do in your life. Most people make many attempts at quitting before they quit for good. The average number of times a person tries to quit before quitting for good is 6. So if you've tried to quit before and have started to smoke again, do not think of this as a failure. Think of this as a step in the right direction. At OhioHealth, we are dedicated to smoking cessation and will help you on your journey to complete abstinence.
When you stop smoking, the benefits begin almost immediately. Within 20 minutes, your blood pressure begins to drop. Within 8 hours, your carbon monoxide levels reduce to normal. Within 1 day, the chance of a heart attack begins to decline. You'll have more energy to do the simple things, like play in the yard, play with your children and grandchildren, and do errands. You'll even sleep better at night. Your risk for a heart attack and stroke will continue to decline. All in all, your quality of life improves when you quit smoking. And once you've quit smoking, you'll know exactly what I mean. The best chances for survival from lung cancer occur if it is diagnosed at its earliest stages. Because you are participating in our lung cancer screening program, we have the best chances to identify if you have a cancer at its earliest stages, before you have symptoms. Lung cancer screening is a low-dose CT scan. This means that the amount of radiation that you will receive is significantly lower than in a conventional CT scan. So you can be assured that this is a very safe procedure. While the goal of lung cancer screening is to detect cancer at an early stage, it does not diagnose cancer. What happens is that the CT scan alerts us to an abnormality, if one is present. If an abnormality is present, over 90% of the time, it is not even a cancer. For example, it can be an infection, or even an old particle that you inhaled sometime in the past, and your body is trying to wall off. Here are 2 CT scans that show an abnormality. One is a cancer, and the other is an old infection that is not a cancer. You can see they look identical. Because we cannot tell if an abnormality is or is not cancer, further testing is needed. If an abnormality is present in your CT scan, the particular type of further testing that needs to be done will be determined by a group of specialists. We will work closely with your primary care doctor. we will determine if the abnormality is suspicious for cancer. As I mentioned earlier, the majority of abnormalities are not suspicious for cancer, and they can be monitored with a series of CT scans in the future. If an abnormality appears to be high risk for cancer, it still does not mean that you have cancer. It does mean that further testing is necessary. This may be an additional CT scan, maybe a biopsy, even surgery, and our team of multidisciplinary specialists will work with your primary care doctor to ensure that you get the best tests and the best treatment. And you always have our nurse navigator to help you through this process. The OhioHealth Nurse Navigator will be there with you and your family for your appointments, for your tests, and to answer your questions. The majority of people that get lung cancer screening will not have an abnormality. This does not mean that you are not at risk of developing cancer in the future. You are still in a high-risk category, and you will have to have another CT scan screening next year. It also does not mean that it is okay to continue smoking. I can't emphasize enough how important it is to quit smoking. For smoking leads to serious health problems in addition to cancer, such as heart attack, stroke, and emphysema. If you are still smoking, begin today. Do your part to prevent lung cancer from happening to you. Speak to your nurse navigator, and she will help you find an OhioHealth tobacco-trained specialist. Thank you for being a part of OhioHealth's lung cancer screening program. You have made an important decision to participate in this program and to take charge of your own health. We at OhioHealth will be with you every step of the way. You are not alone in this journey.